childbirth is the most awaited moment, but also the one most feared by expectant mothers. That moment in which that imaginary child, who for 9 months was idealized by his parents, finally takes shape, acquires a face and a name, becomes flesh and blood. It is a unique and extraordinary experience, which changes life, but which also puts a strain on the physical and emotional resistance of the mother. Knowing what happens to your body at the end of pregnancy and the sequence of events that characterize the birth can help you prepare. By natural or spontaneous birth, we mean that type of vaginal, physiological, and spontaneous birth that a woman consciously chooses to experience. The mother is in full control of her body, but she is still supported and monitored by a medical staff. Prodromal phase. The prodromal period is that preparation phase that marks the transition from pregnancy to actual labor. It is characterized by initially short and irregular contractions of the uterus, with a variability in intensity, frequency, and duration. These contractions have the task of causing the first transformations of the cervix and of preparing it for the next phase. With the passing of the hours, however, they tend to regularize and push the woman to go to the hospital. The mother's fabrics prepare for the passage and exit of the baby. Expulsion of the mucus plug may occur. That is that thick layer of mucus that closes the cervix to protect the uterine cavity from the entry of bacteria or harmful substances. Following the expulsion of the mucus plug, pink or reddish streaks may be noted, i.e. small traces of blood, due to the rupture of the capillaries for the beginning of the dilation of the uterus. Another event that could occur is spontaneous rupture of membranes, also known as water breaking. The rupture of the amniotic sac takes place, which, like a balloon, contains the amniotic fluid in which the fetus is immersed. It is an odorless, clear, and warm liquid, rich in proteins, nutrients, hormones, and antibody, that surrounds the baby during the 9 months. It has the task of protecting him from trauma and infections, as well as keeping him warm and allowing him to train the digestive and respiratory systems. The prodromal phase, as well as the time that elapses from water breaking to the birth, does not have a precise duration, as it varies from mother to mother. However, it is certainly the unequivocal symptom that childbirth is near. Dilating phase. It is the beginning of real labor and is usually the time when you go to the hospital. The cervix has reached a dilation of about 3 centimeters. In the dilating phase, the contractions become more and more intense, more regular, and closer in time. A contraction occurs approximately every 2 minutes, lasting approximately 40-60 seconds. They cause the cervix to open, that is dilation and softening, as well as shortening and thinning to allow the baby to move into the birth canal. The uterus muscles contract from top to bottom, thus pushing the baby's head more and more against the cervix. Women typically have wider, flatter pelvises than men and a wider pelvic cavity to allow for a baby to pass through. Contractions are stimulated thanks to the release of oxytocin, a hormone produced by the hypothalamic nuclei and secreted by the neuroepiphysis. Estrogen induces an increase in oxytocin receptors in the uterus, and the organ becomes more sensitive to the effects of the hormone. Oxytocin stimulates receptors in the uterus, signaling uterine cells that it is time to wake up and start contracting. Expulsive phase. It begins when the dilation is complete. That is when the uterine neck reaches 9-10 centimeters. The ligaments in the pelvis stretch, and the baby will descend into the vagina, the birth canal, until the top of his head begins to be seen. The woman will thus feel the sensation of having to accompany the contractions with pushes. The baby may be in a rear or breech position. The medical team, through some specific maneuvers, will try to correct the position of the baby, trying to favor the spontaneous overturning before delivery. In the event that these interventions are not effective, a cesarean section should be used to facilitate the birth of the child and prevent complications. In natural birth in the cephalic position, the perfect position to be born, the baby flexes his head more and more with the chin towards the chest in order to minimize its size. It also performs partial rotations to adapt to the diameter of the mother's pelvis. Once the head comes out, thanks to the thrusts of the mother, it performs a last rotation of about 4 to 5 degrees to free the shoulders and slip out, finally coming to light. You will finally be able to see the baby, caress it, and place it on your chest, thus establishing the first physical contact. It is a fundamental moment that favors breastfeeding and brings numerous benefits to the physical and emotional health of the baby and the mother herself. Recovery. Even though the baby has finally arrived, the labor is not over yet. It consists in the expulsion of the placenta and all the fetal appendages and usually occurs spontaneously about 15-30 minutes after the birth of the baby. The uterus will continue to contract, even if less intensely than before, so that all residues slip away, which could otherwise give rise to infections. If this does not happen naturally, a small dose of oxytocin is administered to encourage contractions. If not even this intervention is decisive, it is necessary to proceed with manual secondment, which consists in applying light pressure on the woman's belly to facilitate the release of the placenta. Umbilical cord clamping consists of tying the cord itself with nipper in order to interrupt the flow of blood from the placenta. Clamping and subsequent cutting usually takes place 2-3 minutes after birth. They wait for these precious minutes in order to get an extra amount of blood that guarantees the newborn a greater supply of iron and allows him an optimal adaptation to extrauterine life. Childbirth thus marks the beginning of a bond for life.